Hello, I'm Chris Stout. I'm a vascular and endovascular surgeon here at Ozark Regional Vein and Artery Center. And today we're going to talk about arterial disease. Arterial disease is, something that a lot of people and even a lot of physicians don't really understand. Arterial disease, as most people think about it, affects close to 10 to 20 million Americans, and a lot of people don't even know this. The arterial disease is basically a buildup of cholesterol and plaque and other stuff that develops in our bodies as we age. It's something that starts when we're teenagers. We can't help it. And then over time that can worsen and build up, and then it just basically strangles the blood supply to the muscles. And when you can't get blood to the muscles, it's kind of like in high school when you go out and run a mile, you'd feel that burn the next day. So rather than running a mile, you may only be able to walk a half a block, and then you feel that burn or that ache or that tired or fatigue. And that's what the leg artery blockages from artery disease does. We're taught that basically claudication, or the leg pain you get from artery disease, presents as a pain or an ache in the calf muscle, and you got to stop and rest, and then you can go further. That's only about 10 or 15% of the patients with artery disease that are symptomatic or having problems from it. The other 85-90% of patients will have these different types of symptoms that we use fancy words like atypical, stuff like that. And these are basically going to be the patient their leg gets tired, or it gives out on them, or they have some type of weird sensation, or Charlie horse. And those are going to be more of your atypical symptoms, or symptoms that aren't what typically a doctor would think of when they think of artery disease. And that's why many arterial blockages do get missed. So if you think you have some type of regular symptom or atypical symptom, don't chalk it down to old age. Give us a call. We'll evaluate you, and we'll get the testing ordered appropriately.